Hi again. Welcome to How Policy Works, Collective Action in Maternal and Child Health. This is your reminder, as others may have just joined us. Our summit is being recorded, so please keep your microphones off when the speaker's speaking, but please feel free to turn on your camera if you would like, and please think about turning them on when you're asking questions so we can see your face. We have a Q&A portion at the end of every session, and so for those sessions that are more interactive, we ask that you please use the hand raise emoji. If you need help, the name of the tech support person is at the top of your chat box, so you can direct message them if you have any questions. And the chat is also a great way to interact with the other attendees in your session. Please check our legal disclaimer that is found on your screen and our financial disclosures. So our last session for the day and for this summit is presented by Rizwani Biviji. Rizwana Biviji is a PhD and an assistant teaching professor at Arizona State University's College of Health Solutions. She has a PhD in health policy and management from Indiana University. She teaches undergraduate and graduate courses like global healthcare systems, health disparities, and biostatistics. Her research centers around maternal child health, digital health, health policy, and health disparities. Primarily, her research focuses on reducing barriers to high-quality care by evaluating health policies, organizational capacities, and behavioral interventions, including digital health. She also studies consumer behavior patterns and user uptake of digital health tools such as mHealth, eHealth platforms, and telemedicine as means to reduce access barriers and improve health outcomes. Thank you for presenting for us today, Rizwana. I'll turn the time over to you.
Thank you so much for the kind introduction, and thank you all so much for joining me today. The title of my presentation is How Policy Works, Collective Action in Maternal and Child Health. So the agenda for today is I will provide a brief overview on the advocacy process, followed by types of advocacy efforts. How can we go about leveraging social media, building community partnerships, and partnering with professional organizations? And I will be providing examples from my own professional work for the last 3 bullet points. So,
Rizwana, sorry to interrupt you. I don't think we can see your slides yet.
how about now?
Not yet.
It's not showing up?
No. There we go. Yep.
All right. Sorry about that.
No worries.
And now it's showing up all right?
Looks great.
Perfect. So let's move on and talk about a brief overview of the advocacy process. And by no means is this a comprehensive lesson on the policy process, rather a 7,000 feet view on the current landscape of how it looks like both at the state and the federal levels. So what is advocacy? Advocacy is defined as any action that speaks in favor of, recommends, argues for a cause, supports a defense, or pleads on behalf of others. Now, there are different types of advocacy efforts that you could be involved in, including lobbying, but the focus of today's presentation is on grassroots level advocacy efforts. So when it comes to federal advocacy, Congress is your legislative branch of the federal government with 2 distinct chambers, the House of Representatives and the Senate. Both of these chambers have different set of roles and responsibilities, but when it comes to passing of the bill, it should pass at both chambers in order to become law. So now we are in the 118th Congress, which spans from January 2023 to December 2024. So it is a 2 year cycle. And when it comes to House of Representatives, there are 221 Republicans, 212 Democrats, and 2 vacant seats, which means that there's a very small majority by about 7 seats for the Republicans. And divided Congress plus small majority means interesting times at Congress, especially for those who are active in the federal advocacy space. On the Senate side, we have 49 Republicans, 48 Democrats, and 3 independent who essentially caucus in favor of the Democrats, which means they vote in favor of the Dems. So this kind of makes it a 51 to 49 ratio. So looking at the legislative process, the bill has to be first introduced in the House, and only a representative can introduce bills in the US House of Representatives. The bill is then assigned to a committee for study. This committee consists of representatives who are experts on a given topic. The committee will then review, research, or revise the bill before voting. If released by the committee, the bill is put on a calendar to be voted on, debated, or amended. If the bill passes by a simple majority, that is 218 out of the total 435, it then goes on and moves to the Senate. And there is a similar process where it is assigned to a different committee. And then if released, debated and voted on, again by a simple majority, that is 51 by 100, the bill would be passed. And there are a couple of steps before the bill goes on and moves to the president, who has around 10 days to either approve or veto the bill. If the bill is approved, is passed, then the president would go ahead and sign it into law. And if it is vetoed, then you could reintroduce the bill into the House, and the process is very similar. And one thing to note is that out of the many bills that go through Congress, less than 1% go on and eventually become law. I'll now talk about the state advocacy process, and this is slightly more difficult as compared to your federal advocacy process, mainly because each state is different. So if you know a state, you know a state. And looking at the key players in the state, you have your state legislators, who are your elected officials, and they serve in state legislatures for a fixed period of time. Their roles and responsibilities and the term duration varies from state to state. And essentially, they are mini Congress. So they are responsible to introducing and passing laws at the state level. You then have your governor, who oversees the state legislature and is in charge of signing a bill into law. And then you have your state attorney general, who serves as the legislative counsel for the state legislators and the governor. So the governor for the state of Arizona is Katie Hobbs, and the state attorney general for the state of Arizona is Chris Mays. Now, typically, all states have a bicameral legislature, that is 2 chambers, the House and the Senate, except for the state of Nebraska, that just has 1 chamber. So this leads me to my next point, which is that each state is different when it comes to the composition of its members, as well as the timing of the legislative session. Certain states are in session for the entire year, while others are in session for 6 months or 90 days. And then there are a few that meet every other year on a biannual schedule. So for example, here in Arizona, the session starts on second Monday in January and lasts for 100 days. This is not to say that there is no activity for the remainder of the year. It's just that they're most active during the legislative session. And the governor can call for special sessions outside of the regular sessions for special issues or emergencies. So let's move on and talk about the types of advocacy efforts. There are 3 categories of activities that you can engage in, and I like to call it as the 3 E's, which is educate, elevate, and empower. So these activities which come under educate can take you anywhere between 5 minutes up to an hour or even beyond. So for example, engaging with an action alert, posting on social media and tagging your elected officials, writing an email to your elected officials, sharing your expertise on a given issue, scheduling a meeting with elected officials to discuss a specific issue, attending town hall meetings or policy events, and or sending a letter to the journal editor. Now, I will be covering each of these examples during my talk and my presentation. The next is to elevate, and these activities will take you anywhere between 1 hour and going up to a day, which would include identifying potential partners, establishing relationships with policymakers at local, state, or federal level, writing an email to your elected officials, sharing your expertise on a given issue, attending town hall meetings, or participating in advocacy summit or hill visit meetings. The next is to empower, and these activities may take you longer, and there's no specific time period. It may take you a few months or even a few years when you're engaging in these type of activities. And this would include introducing and tracking legislation, testifying at a legislative hearing, volunteering for a policy advocacy organization. And this, I would say, is very important, especially if you're new in the advocacy space, is to look for an organization who is working for your cause. And this would give you an insider perspective as to how policy process works. And this nicely ties into my next point, which is training first-time advocates. So like once you have been trained, once you have received the necessary expertise, then you can go on and pass it on to other members and train them, and especially provide that insider viewpoint on how the policy advocacy process works. Other examples are sharing success stories from other advocates as a model, and active participation in MCH-specific coalitions or task force. So when you talk about coalitions or task force, they are comprised of key stakeholders from a given geographic region, whether it's state or your local community. And these coalitions and task force members would have very specific agenda items and deliverables that you would work on and complete in a given time frame. Next, I move on and talk about leveraging social media. Social media is the next big thing. Most of us are using social media, and so are our legislators. So this is a good space to get involved in and use. And most, if not all, have multiple social media platforms. And when you think about social media in the advocacy process, I like to think it as that you can use it to educate, advocate for, or elevate the voices of those communities who do not have a voice on the table. So looking at trends in social media, like I mentioned, many legislators are now active on social media, and you will see that they have more than one account and they are present on multiple platforms. So for example, most of your legislators are active on Twitter, followed by Facebook or Instagram. And even as you are deciding to build your professional identity in the space of advocacy using social media, I would say that if you are wanting to communicate with the legislators, if you're wanting to be active, in the eye of the legislators, then Twitter is a good platform. While if you are wanting to create a larger base and target a larger audience, then maybe Facebook or Instagram would be a better platform. And the number of legislative messages sent by members depend on the congressional term of the year. So of course, they're going to be more active when the legislature is in session and when it's time for elections or re-elections. So one thing to know is that this year, we are very active when it comes to legislation, both at the state and federal level, especially even at the federal level, given that next year is the election year. And that means it's a shorter year for the legislators. So be on a watch, right? Like be current with what's going on. Look at what's in the what bills are being passed, what is happening, both at the state and the federal level. To the right, I share an example of the Twitter page of Senator Sinema. And as you can see, she's very active and has around 200,000 followers, which is huge. And even if you were to follow through her profile, you will see that she consistently posts. So like there will be a post every day. And this is one of the tip that I would like to say is that when you are on social media and when you're using social media to educate or to advocate for, you need to be consistently posting. If you were to post today and you were silent for next 6 months, then that's not going to build your professional identity and that's not going to build any credibility in this space. Next is to tag your legislator. This again is a very important way, especially when it comes to education. So we as academicians, community workers, or healthcare providers, we are the content experts. They are not. We know the data. We understand the issue. And they want to learn from us. So educate your legislators about the issue. Share educational materials from reputable sources. For example, on the left, I am sharing a post by the Black Maternal Health Caucus, and they have tagged their representatives Underwood, Adams, and Senator Booker. And this tweet, if you see, is very comprehensive. They're talking about the Omnibus Act and saying that that is the solution for a maternal health crisis. As you see, it is having good picture, it is having a very concise text, there is good colors associated with it. And even in terms of traffic, it has high traffic in the sense that there has been 8,000 views, 53 likes. So there's a lot of engagement on this post. To the right, you'll see an example from a fellow academician who again has posted an op-ed which argues that we don't need grocery taxes that goes on to exacerbate health inequities. Again, a concise text. She has also linked the Chicago Sun-Times article that is covering the op-ed, talking about this piece, providing data. And she's tagged the legislator, that is Governor Pittsburgh from Illinois. There is an image as well, which makes it more attractive when you look into it. On the extreme right, I'm sharing some Twitter handles of our senators and representatives. And by no means is this a comprehensive list. It is just some of the legislators I have seen on Twitter and some of whom I follow. Next is to use appropriate hashtags. This is, again, very relevant, especially when you're building your professional identity in the space of advocacy, is to research and use relevant hashtags to increase the visibility of your content. Hashtags can help your post reach a broader audience and connect with others who are discussing similar issues. So for example, on the left, I share an example of a post that I tweeted around my research work, which I was presenting at a conference in spring of 2023. The research is about looking at access to vision care services among children in Arizona and the differences between children on Medicaid versus private insurance. So when you think about hashtag, there needs to be some strategy as to what type of hashtags you are wanting to use, as to whom you are wanting to target and who your target audience is. So I like to think it as that way, that use hashtags for the issue, for the solution, and the population. So in this example, the issue is vision care services and Medicaid versus commercial insurance. So I've used hashtag vision, hashtag Medicaid, and the population is children in Arizona. So hashtag children and hashtag Arizona. To the right is another example of a presentation that our research group presented for a conference. And this was in partnership with Trimester Arizona, who are the sponsors of this event. And the title, as you can see, is Addressing Perinatal Mental Health with a Diverse Workforce in Arizona, a Call to Action. So again, the issue here is perinatal mental health. So hashtag perinatal, hashtag mental health. And the solution is to diversify workforce in Arizona. So I have used hashtags diversify and then hashtag Arizona. So think through the strategy, what works best for you. This is the strategy that works for me. And the other thing I like to say is that your posts should be timely and effective. So try to follow posts on international days, national weeks, months, in order to gain visibility. because your legislators are also active during that time. So on the extreme right, I have shared some of the hashtags that you may want to consider as you are working in the space. That is hashtag Black Maternal Health Week, World Mental Health Day, World Breastfeeding Day, your Maternal Mental Health Week, which is in the month of May, maternal mortality health, and maternal mortality. Next is to engage your audience. This again is very important, and you need to post compelling content in order to attract and retain your audience's attention. Use a mix of text, images, videos, and infographics. For example, on the left, the post by the Blue Dot Project is about using a nice infographic. They have a very concise text. They have used the hashtag of MMHV 2023. So again, this was in the maternal mental health week in May. And they have a clear message. Did you know? Not just moms, maternal mental health disorders impact the whole family, not just women. So this is again very clear, to the point, and an effective message. On the right, I am sharing another example by One Mom is Too Many. And this is a video testimonial about a survivor who has gone through hyperemesis gravidarum. Using video testimonials is very powerful. When you are having patients, when you are having stakeholders who have lived experience for the given issue, then essentially you are providing voice and heart to the issue. This is also very important when you're trying to compel your legislators to vote in favor of the issue and support the issue. So in summary, on this slide, your content should be informative, which is share well-researched information about the policy issue. It should be compelling by using compelling stories and visuals to engage your audience. It should be shareable, right? So create content in such a manner that others are able to retweet it, repost it, so that you can have a larger audience base. And finally, it should be actionable. Include clear calls to actions in your post, guiding the audience on what to do next. Engage with your followers very, very, very consistently by responding to comments and messages promptly. Encourage discussion, ask for feedback, and create a community of supporters around your cause. So this brings me to my next portion, which is connect with communities. And this nicely ties back to the previous slide, which is think broadly about who you want to connect with. For example, I connect with fellow MCH researchers, community organizations, policy advocacy groups, and healthcare providers. There are many communities of patients and other stakeholders with an active voice on social media. So for example, if you were wanting to see what is being posted in, given a certain issue and who is posting it, and if you wanted to connect with other organizations, other stakeholders, or even patients, you could use certain hashtags like hashtag miscarriage, hashtag postpartum, hashtag breastfeeding, hashtag teen pregnancy, based on the issue that you're working with. And if you wanted to narrow the scope, then you could add an additional filter like Arizona or Phoenix. And this is going to give you all of the posts that people are talking about in this space and in a certain geographical area. And you don't need to limit it to just social media relationships. You can actually have these people and invite them to meet over a cup of coffee and ask them to share their experiences, to share their lived experiences. You can ask them to join a task force or even invite them to speak with your legislator. And the next thing is to host or participate in Twitter chats. So for those of you who are not familiar with Twitter chats, these are guided discussions that are often organized by organizations or even individuals. So you come in with a set of predefined questions and anybody is welcome to join. And then you would use these questions or the prompts to guide the discussion in a certain direction. And I've seen in the past that individuals also invite their local media representatives to come cover the event as well. to gain a greater limelight. So some of the professional organizations who regularly host Twitter chats are Society of Behavioral Medicine and American Public Health Association. They have a regular Twitter chat during the National Public Health Week. To the right, I have shared an example of a Twitter chat that I participated in. And the question was, how can we make science more digestible for lay audience? And my response was to be as approachable to the community by using hashtag science communication materials that speak to your audiences and not solely your academic colleagues. That is no two jargon like methodology and the Next, I jump and talk about building community partnerships. And here I provide specific examples pertaining to academic and community partnerships by providing some personal examples of the work that I have done in this space. So the first project, which is more current and recent, is addressing perinatal mental health with a diverse workforce. Second is fighting prescription drug abuse through state policy. Third is improving patient-doctor communication about risk and choice in obstetrics gynecology. So this first project is in collaboration between Arizona State University's Maternal and Child Health Translational Team's Policy Core, that is co-led by myself and Dr. Angela Lober and Dr. Jenny Beaver at Trimester, Arizona. We also have two students working on this project. One is a doctoral student and the other is an undergrad student, and they have distinct roles that they are playing on this project. There were three deliverables that stemmed out of this project. The first is the conference presentation, which I talked about a few slides ago. A policy brief, which nicely summarizes the policy efforts at the federal and the state level. And this has been accepted by Health Affairs Forefront, and it's going to be published soon. So be on the lookout for that. And the third is an infographic and a report that we prepared for fourth trimester Arizona. This focuses more at the state level data. And this will be used by fourth trimester Arizona to advance their policy efforts by sharing it with other key stakeholders as well as with legislators. On the extreme right, you will see an example of the infographic that we prepared for the organization. And again, the same concept that it should be visually appealing. We should have the most important point on one or maximum 2 pages, because no legislator wants to read a 90-page report or a research article. So you should be able to summarize the most important information in 1 to 2 pages, as well as make it visually appealing for them so that they will take interest in what you have to say. The next is fighting prescription drug abuse through state policy. And I worked on this project when I was a PhD student and as part of a 2-semester long coursework, which focused on service learning activities. So in semester 1, we were members of a task force, which is Indiana Prevention Drug Abuse and Prevention Task Force. And we met every month. And there were very clear guidelines, action items, as well as deliverables that we as academic partners were supposed to deliver. And based on that, in semester 2, we worked on submitting and publishing a review article in the Journal of Addictions Nursing, which focused on the role of nursing in reducing prescription drug abuse in the state of Indiana. And the next is improving patient-doctor communication. This was a call to action and a collaboration between PhD students and med students, of which I was a part of. And we sent a letter to the editor, which was eventually published in the Journal of Clinical Ethics. So you'll see that on the right. And do note that I have shared these materials on the conference app as well. So if you were interested in learning more about these projects or how to write a letter to the editor or submit a review article, you can very well look that up or connect with me as well. There are other ways that you can get involved is by writing op-eds, policy statements, or public-facing articles by partnering with professional organizations. And this leads me to the final piece of the presentation. So what are some of the ways that you can get involved? Most of the organizations or professional organizations that you're involved with has some space related to advocacy. I share the three professional organizations that I'm most active with. So the first is Academy Health, which is very focused on health service research. And they offer a lot of training materials for advocacy efforts, including how to build relationships with your legislators, or how to write a testimonial, or how can you email a legislator, and those type of things. Next is that they also offer a health policy orientation workshop, which is a 2-day workshop. And this is relatively new, but the one in 2023 is coming up during the end of October. So be on the lookout for that for 2024. The only thing is that they cap the maximum number of participants at 15. So they do send out a call for interest around the month of January or February, and then they open their and accept applications in the month of June. The next is American Public Health Association, and they are huge in the advocacy space, especially for public health related topics. And one way to get involved with would be to write policy statements. So on the right, I have shared an example of a policy statement that I worked on as part of the deliverables during my PhD program, was to submit a policy statement to APHA. And their process is very similar to how it functions at the state or federal levels, is that they would assign this policy statement to a committee. The committee would review it and send it back to you with revisions. Then you further send it back with your revised version. And if they want to move ahead with it, then there would be a public hearing during the annual meeting, and the governing council would vote in favor or against the policy statement. So here you see that the policy statement was accepted and it has been approved by the American Public Health Association. Once it's approved, they put it in their policy statement database, which is available for everyone to see. And this policy was published in November 2015. And then the third is Society of Behavioral Medicine. They have what is called as the Health Ambassador Program, of which I am a part of. It's a 3 years commitment, and this program essentially focuses on building relationships with your legislator. So I'm working with Senator Sinema's office, and the main role is to educate. So you are educating, you are the content expert, and you are acting as a sounding board for the legislator when they have any questions pertaining to a topic or an issue. They have 3 priority areas, which is child nutrition, climate change and health, and non-pharmacological pain management. And I'm working under the child nutrition umbrella. And next again is position statements. Like I mentioned, the process is very similar, but you submit the position statement, and if it gets approved, then the Society of Behavioral Medicine would basically be supporting it and endorsing it. So in summary, advocacy is easy to fit into your lifestyle. Identify an elected official who cares for the issue. Be specific in your ask. What are you exactly wanting from them? Gather your community of advocates. And finally, remember, you are not alone. So with this, I thank you very much. Email me, follow me on Twitter, or you can also connect with me on LinkedIn. Thank you very much. And I'm going to now pass the floor on to Nikita Mahmood.
Thank you so much, Dr. Baviji. This was so informative.
Thank you.
Thank you. I do agree. This was wonderful information. Just so great to be able to get this out to the folks in this forum who all care about maternal child health issues, who want to see a change, and helping them understand and making accessible how policy works. So I want to speak more about that. and share my personal experience at Mom Congress this year, just last month. So my co-conspirator, Dr. Jenny Beaver, we were having a conversation maybe 3 months ago, and she said, "Oh my God, Lakeisha, we have to go to Mom Congress." And I was like, "Jenny, what is Mom Congress?" So it's pretty self-explanatory, but it goes so much deeper. So Mom Congress is an organization that empowers mothers to come together and advocate for legislation around maternal and child health issues. So they do that in multiple layers. So you begin by doing bill trainings virtually before you even go to Washington, D.C. and go to the Capitol. And the purpose of that is to orient you to these bills, to help you understand the language, to know what you're going to be talking about when you sit down with your chosen legislators. So we also, or that organization also helps provide training around leveraging lived experiences as mothers. So you're there to share the things that you have gone through personally with your chosen or with your legislators. So that in combination, you travel to Washington, D.C., you set up the meetings with your senators, with your House of Representatives. Usually you're going to meet with their staffers, which is fine because I think staffers run the world. They're the ones who really wield the power and know what's going on and what's happening. So you sit down with these folks, you talk to them about the bills, you have it all laid out in your dossier, you have information to leave with them along with your personal information. One of the things I learned from Jenny is a lot of this is relationship building. So you're sitting down with them once, but you want to follow up with them. You want to talk with them even after this event has passed. And I think that's really important. You know, I'm a 44-year-old woman. And with Mon Congress, this was the first time that I really engaged in advocacy on this level. And I was honestly really nervous. I'm going to be transparent about it. I didn't know, maybe fear of rejection. I didn't know if I would just, walk in and they would be like, just, I don't know, dismissive, maybe a good word. But I found the opposite to be true. And one of the things that Mom Congress does is it helps to build confidence in that area. And I can't remember what session it was that I sat through, but the person that was presenting just shared the words that you are their constituent. It is their responsibility for them to hear you, to take the time to listen to you, and they should be held accountable for what the information you present to them and what you have to say. And that just really hit different for me. I was like, you know what? You're right. I'm their constituent. They should listen to what I have to say and take the time and sit down with me and hear about these maternal health bills. That led to me just walking into my personal representative's office with no appointment or anything. We just walked right in there and said, I'm a constituent. And they said, from Maricopa City? Yes, City of Maricopa. That's where I'm from. And we were able to sit down with that staffer and share this information, as well as with the senators. And there's such also a feeling of being supported. You really don't feel like you're alone. Jenny and Kaylin and I kind of stood with each other and helped each other and coached each other and through all of these presentations, and it was really wonderful. And that experience for me really ignited a fire to step into the role of advocacy in this space as well. I think throughout my 20-year career, working in the maternal fetal health space, it's been about education. It's been about those grassroots things and working one-on-one with families. But there is another level to that when we start to think about how these policies directly affect our lives. So we have to understand that we do have a political power in that space. Our voices can be heard, and finding ways to effectively do that is important. And also finding ways to connect with others and collaborate and using our power in numbers and activating that power that we have of unity. So I'm going to pass it over to Jenny to talk more about collaboration and unity.
Thanks so much, Lakeisha. It was such a great time having you with me at Mom Congress this year. Yeah, it's always such an inspiring event. And this was my third year being there. And it was even more inspiring having you with me. So thank you for making that trip and taking that time. Yeah, it was amazing. So a lot of what we do with fourth trimester is advocacy. And I know I mentioned that in the beginning session yesterday, that has always been rooted in our vision, that we needed to change things, right? That those things really needed to change. And I don't think it's until this year that I actually acknowledged that that was something that we were doing as a program, like as something we actively wanted to do. And I think it was actually when I was writing those slides that I was like, oh, actually, that is something we do. But the longer that I've been in this role with fourth trimester, the more I've realized that we can do, and we do a lot of work on the ground level, helping moms, right? Moms and babies every day. And all of that work is so important, so important. But at the end of the day, a lot of the work we're doing is band-aiding broken systems, right? It's really putting band-aids over things that should be covered, things that shouldn't be happening, things that should be fixed and aren't. And so for me, working in policy and starting to look at this as like one of my jobs, right? One of the things that I really need to do has been kind of an eye-opening thing, right? That is actually a critical piece to my role in, changing the culture of parenting, so no one has to do it alone. And I have been so inspired, both by Mom Congress and working with the Maternal Child Health Translational Team's Policy Core, who literally came to me and were like, what policy stuff do you want to do? And I was like, really? You want to help with that? I was so inspired by that, that Lakeisha and Kaylin, my stepdaughter, and I were sitting in the Canon office building, which is one of the office buildings at the Capitol, like waiting for another one of our meetings. And we're in the cafeteria, right? And we were like kind of looking around, seeing what legislators are there, like assuming that this is where the real work happens, right? And I'm kind of like looking around and I was like, it would be really cool. What if we created something in Arizona that we could use and that we could bring people together to actually work on this policy stuff, right? Because we know lots of people are interested in advocacy and policy. We're definitely not the only ones who feel like this is a place where things need to happen in Arizona. And so, I don't know, in about 5 minutes, we kind of hatched the idea of the Arizona Maternal, let me get it right. The Arizona Maternal Health Policy Core. Sorry, I still got it wrong. The Arizona Maternal Health Policy Coalition. Thank you. You can tell we're still getting it. We're still getting it there. But this is a coalition that we are forming as a group. Right now, it's the ASU's Policy Core in Maternal and Child Health, fourth trimester Arizona, and the Arizona Birth Workers of Color. We're going to work together to begin to build this policy coalition. And we would love, love, love to have your help, all of you on this call and this summit today, as well as anyone else who's interested in advancing maternal health policy. It is something that we can't do alone. And so we have created an interest form for you to complete if you're interested, and we will absolutely reach out. One of the huge advantages of having ASU on our team is that we'll have access to people like Dr. Baviji who know a ton about this, but also to students who can take these policy briefs on as a project that they're going to do. And that was really how we got that policy brief completed on increasing the diversity in maternal mental health providers, which is amazing. I'm so honored to be part of it, and also shocked with how quickly it was accepted. Dr. Baviji, I was like, wow, it's going into health affairs, which is huge. So just knowing that, we can't do this alone. We've got to be doing this together, and that we do have a voice is a huge, huge piece of this. And we would love to have all of you join us in this effort. So if you're interested as an organization, if you're interested as an individual, please reach out. You can reach any of us on our social media or on our emails and fill out the interest form. We can't wait to have you be part of this. And that's all I have to say on that.
Congratulations.
Thank you, thank you, thank you.
Absolutely. I think this is wonderful. And I, for one, am excited to partner with the organizations and others who are interested in this type of work, because again, it is so important. So, and our students, they love to be part of this experience as well. So this is, of course, very important for all of us who are on the call, but even the future leaders, because they need to also be a part of the solution. So thank you for involving us. And if you all needed any more information about ASU and ASU's Maternal and Childhood Transformation team and some of the work that we do, I'm gonna post that link as well for you all to just browse.
And just to
Well,
go that and share a success story from our work, Jenny and Kaylin and I in Washington, D.C., we were able to get one of our senators to sign on to one of the maternal child health bills as a sponsor. So I was so proud when that email came through, because it just, I mean, instant gratification, of course, but just seeing the success and the impact of our work was really amazing. And it's addictive. Like you want to continue that. You want to continue to see that impact on a larger scale. So I'm so excited to be a part of this, and just another level of community building is so exciting.
so I wanted to make sure that we had time for questions for Dr. Biviji, if there are any in the chat.
I did not see any questions in the chat, just lots of comments about how important this conversation is. And thank you for sharing. So, yeah. If I missed anything, please raise your hand. Ask away.
I was going to say, Dr. Babiji, if you're okay with that, I think your slides would be super useful for many of us who do advocacy. I love that you created a primer and it was so clear to follow. And I think for a lot of us, that's what we've needed, right? There, you see a lot happening, but you don't actually know what the steps are. So yeah, I think that'd be wonderful.
Yeah, absolutely. I'm happy to share. And thank you all so much for joining. And even if you all had like any question, even beyond that, please feel free to reach out. I'm always happy to answer any questions, or especially even with Twitter. For some of us, I know I read on the chat as well that, you know, this is not something that you routinely do or routinely think about. I was new in that space as well, but honestly, like once you are used to it, you kind of start understanding the process. And the whole idea is the more you feed in, the more you get comfortable with it. So again, if there was anything that you needed from me, feel free to reach out. And of course, Jenny, I'm happy to share. Dr. Weaver, I'm happy to share.
Kendra, I guess we're going to head back to you.
Okay. Okay. That wraps up our last session. What a great day. What a great couple days. So before we close out our last day here, as many of you know, Fourth Trimester Arizona exists to change the culture of parenting so no one has to do it alone. Our vision is to see all families embraced by their communities in their transition to parenthood. We can't do it alone. It takes all of us together to make a difference. Your financial support is vital to allow us to continue to cultivate local villages of support. And as today exemplifies, to unite providers across the state to provide the very best for all Arizona families. So before you unplug for the afternoon, please consider a donation to us. No amount is too small to make a difference. You may be asking, how do I do that? So you can scan the QR code on the screen to be directed straight to our donation page and make a one-time gift of support, or better yet, set up a recurring donation so we can continue our mission work into the future. And you can also visit our website at fourthtrimesteraz.org to make donations as well. As a not-for-profit organization, Fourth Trimester Arizona are volunteers that believe in this work because we as parents have relied on the very support we're offering you and your families. So please join me in financially supporting the organization. The staff here at Fourth Trimester Arizona is always trying to improve and make our programming, conferences, and summits the best we can offer. So please take a moment to complete the summit survey by scanning the QR code, or it can be found in the chat or on Whova. And for those who purchased continuing education or certificates of attendance, you will be receiving an email with a separate link to complete a program evaluation. It has truly been an honor to be with all of you today as we learned important information about the state of our communities, maternal and child health and development, and family-centered care models to better our practices and ourselves. The last 2 days have been so informative. Thank you to all who participated in and helped plan this ecosystem summit. I'm going to turn the rest of the time over to Dr. Jenny Beaver, Fourth Trimester Arizona's President and CEO.
Thank you so much, Kendra. And I want to make sure that I acknowledge your great work today, as well as the great moderating work of Lakeisha Muhammad. Thank you so much for all your help with all of this. I also want to make sure that I acknowledge the volunteers who have been helping, especially behind the scenes, because I think they didn't get acknowledged yesterday. Dina Tipshraney, who has been making sure all our speakers are here and have what they need, which is a huge deal. And Raquel Adkison, who has been rocking the chat support. Thank you both so much. Now, I want to take a deep breath to acknowledge all the deep topics that we've explored today, and to really give a heartfelt thank you to our speakers. Weren't they amazing? Like, didn't we have like the best lineup ever? I think it was my favorite ever. So thank you, speakers, for sharing your expertise, your knowledge, and your passion with us in presenting yesterday and today. I have learned so much, and I hope you have too. So many of our speakers have talked about changing policy in the ways that we can. Those of you who would like to work with us on this in community, please fill out the interest form for the Arizona Maternal Health Policy Coalition. We can't wait to get this started and are so thrilled that we're taking this on in community. Those of you who were with us yesterday morning may remember that I asked everyone to tell us their role in the fourth trimester ecosystem. And that's because I felt it was time to update the ecosystem slide, right? So this is what we heard. Participant, a vital role, education, doula educator, ADHS MMRP staff, midwife, social worker, public health, nurse home visitor, support others, postpartum RN, advocate, RN, speaker, nurse. And so I took those pieces that were not already on our ecosystem image and put them on a new slide. So here we go. We have updated our image. And so those of you who added those in, if they weren't already there, you'll see that they show up in the light yellow on our fourth trimester ecosystem slide. And I hope that as we continue as an ecosystem, this gets bigger and bigger and bigger until we make sure that everyone who supports and touches mothers and babies ends up on our ecosystem and feels that they're a part of this as well, because of course they are. I also asked our ecosystem, what gift they'd like to give to Arizona families. So those of you who were in the session yesterday morning may remember this. Here's what we heard, and there were a lot more in the chat that we didn't capture. I believe that when we speak something out into the world, we begin to make it a reality, for real. Not only when we envision it, but when we say it. So if you see your answer to this question, or if you resonate with any of these answers, please speak it out to yourself now. I'm going to speak some of them right now too. What gift would you like to give to Arizona families? Happiness, peaceful birth, validation, creativity, connections, security, confidence, peace, resources, comfortability, free ECE care, respite support, preparedness, deep support, love, and good food. Amen to that one. Altogether, this is what we as a fourth trimester ecosystem are imagining for families in the next year. It's pretty darn amazing, actually, if I do say so. I love doing this visioning exercise. I want us to take a moment now to take it in with a deep breath. Let's breathe in those visions deeply now. And breathe them out gently and fully. And those of you who participated yesterday with Humming for the Heart, if you want to take some time after today's sessions and use those breathing techniques and those movement techniques, I think that they will help too. I thank you all for these amazing visions of the future, and I look forward to seeing us move forward as a state to make these a reality. Remember that we can do so much more together than we can do individually. So if you haven't reached out to someone yet to talk about making your dream or your vision a reality, take some time today to do it, right? We're on a weekend. You might have a little more time. Reach out. Together, we can make our state a better place. I really, truly believe that. It takes a village, and we've got one. So let's use it. And we can make our state a better place for maternal and child health now and in the future. I'm sending all of you off with lots of love. I hope to connect with you all soon, whether on Whova, at other gatherings, on social media, at fourth trimester villages, or at our fourth trimester conference for parents in the spring. Thank you to all those who supported this summit and spoke for us today. And thank you to all of you for being part of our fourth trimester ecosystem. Have a great rest of your weekend.